Have you ever noticed a little crease on someone's earlobe? It could mean something more than just genetics. This small, easily overlooked detail might have a big story to tell, especially about your heart. Stay tuned. Welcome everyone, I'm Gary Carlson, a health researcher with a full-time practice in musculoskeletal medicine. An earlobe crease might not seem like much, but there could be more going on, potentially a lot more. This physical marker is called Frank's sign, named after Dr. Sanders T. Frank, who first published a study on it in 1973. He observed a diagonal crease running at about a 45-degree angle from the bottom of the ear canal to the lower edge of the earlobe, and proposed that it could be a marker for coronary artery disease. Since then, the medical community has debated and studied this possible connection for decades. So is this crease just a coincidence? Or is it a warning? What does the research say? Multiple studies over the years have looked into this curious link, and while not everyone agrees, the evidence is surprisingly consistent. For example, a 2021 meta-analysis looked at over a dozen studies and found a significant association between earlobe creases and heart disease, especially in people under 60. In many of these cases, people with the crease were found to have atherosclerosis, which is the buildup of plaque inside arteries that can lead to heart attacks or strokes. One theory is that the earlobe and the heart's blood supply share similar microvascular characteristics, meaning that the damage in the small blood vessels of the earlobe may reflect similar damage in the coronary arteries. But just to be clear, having an earlobe crease doesn't necessarily mean you have heart disease, and conversely, not having one doesn't mean you're in the clear. It's a potential marker, not a diagnosis. So should you be worried if you have the crease? Let's just say you checked your ears in the mirror and you noticed the crease. Should you panic? Definitely not. But it might be a good idea to check in on your overall heart health. Think of the earlobe crease as a potential red flag, sort of like the check engine light on your car. On its own, it doesn't tell you what's wrong, but it could mean that something deeper needs a closer look. So here's what you can do. First of all, know your numbers: blood pressure, cholesterol, blood sugar, body mass index. These are all essential in assessing heart risk. And secondly, it's extremely important to listen to your body. So things like shortness of breath, fatigue, chest discomfort, or even unexplained nausea could signal heart issues. And talk to your doctor. If you notice the crease and you have other risk factors like smoking, a family history of heart disease, diabetes, or any other symptoms or warning signs, it is worth mentioning. Heart disease does not just strike older populations. A significant percentage of heart attacks occur in people under 40, and unfortunately, that rate is increasing. So doctors don't use earlobe creases as a standard diagnostic tool, and you won't see it on a checklist for heart disease, but in the right context, it can be a helpful clue, especially when paired with other signs or symptoms. So it's not a magical predictor, but it is an example of how the body sometimes gives us visual hints about internal health. If you spot a diagonal crease on your earlobe, don't panic, but do pay attention. It might be a subtle sign encouraging you to take a closer look at your cardiovascular health. And really, that's good advice for all of us, crease or no crease. So the next time you catch a glimpse of your ear in the mirror, take a second look. Your body might be telling you something worth hearing. If you like this video, please consider subscribing to the channel. Doing so is free, and it simply tells YouTube to share my content with more people. As a new channel, I would really appreciate it. Be well, and see you next time.